By having a family members such as your parents and siblings being diagnosed with breast cancer will increase your risk of developing breast cancer itself. But without any family members with breast cancer doesn't mean that you will not be developing breast cancer. I'm Dr. Tan Chi Kiang, a clinical oncologist at Thomson Hospital Kota Damansara, and I'm here to answer your questions about breast cancer prevention and treatment. This is Ask a Doctor. When someone diagnosed with breast cancer, what it means is that the doctors have done some investigations, and from the investigation they detected some abnormalities originating from the breast itself. Breast cancer peaks at 50s or 60s, but younger female as young as 20s also can get breast cancer. Generally, breast cancer, it is a female disease, but that doesn't mean that male can't get breast cancer, even though it is less common compared to female. Some patients do ask about breast self-examination and what it is all about. Breast self-examination is when someone without breast cancer actually examines their own breast at a regular interval. Breast self-examination is a less effective method compared to other breast cancer screening tools such as mammogram, ultrasound or MRI. This is because you need a lot of practice and experience for you to be able to pick up a small lump in the breast. However, breast self-examination is still a good tool to create awareness on the importance of early breast cancer screening. Even if you do not have breast lump, that doesn't mean that you are actually safe from breast cancer. Reason is because in the early stage of breast cancer development, generally they do not present as lump. It's only when the lesions of the cancer has becomes of reasonable size, then only you can actually feel the lump in the breast. Therefore, it is actually very important for us to, before even feeling the lump, to go for regular breast cancer screening to detect the cancer early before you can actually feel the lump itself. By having a family members such as your parents and siblings being diagnosed with breast cancer will increase your risk of developing breast cancer itself. But without any family members with breast cancer doesn't mean that you will not be developing breast cancer. This is because 90% of breast cancer is related to lifestyle. It's only about 5 to 10% of breast cancer it is associated with genetics. Some patients might feel discomfort during the mammogram procedure. However, the benefit of mammogram outweigh the small discomfort that it can cause. This is because mammogram is a very effective tool to detect breast cancer early. Like most tests, it is not 100% foolproof. However, it is still recommended for female aged 40 years and above to go for annual breast cancer screening tests, which may include mammogram, ultrasound, or MRI of the breast. Generally, mastectomy is one of the treatments that we use to treat some patients with breast cancer. However, not all breast cancer patients require mastectomy. There are some patients which you can actually just remove the cancerous lump and then taking some sample from the axillary lymph nodes and hence do away without removing the whole breast. However, it will be subject to a few other factors such as the disease itself and patient themselves. When a patient being diagnosed with breast cancer, some of the treatment that we use will be either surgery, systemic therapy such as chemotherapy, hormonal therapy, targeted therapy or immunotherapy, as well as radiotherapy. All these treatments are available in Thomson Hospital, and which treatment that the doctors will recommend will be depending on the stage of presentation as well as the other factors such as patient's underlying medical condition and etc. Based on all these factors, the doctor will make the best recommendation on what will be the appropriate treatment for the breast cancer patients. If you are interested in finding out more about Thomson Hospital's cancer treatment facilities, visit our website in the link below.